The year 2001 was the start of a new millennium, a time filled with hope and anticipation for what the future would bring. People around the world celebrated the dawn of a new era with grand festivities and high expectations. It was a time of exciting new technology and scientific discoveries. The early 2000s saw the rise of innovative gadgets, from the first flip phones to groundbreaking advancements in medical research. The world was rapidly changing, and it seemed like anything was possible, but hidden in all the excitement, a new virus was spreading. Amidst the bustling city streets and crowded markets, an invisible threat was beginning to take hold, unnoticed by the majority of the population. Scientists in the Netherlands found a virus no one had seen before. This discovery was both alarming and intriguing, as it opened up a new field of study and raised many questions about its origins and potential impact. It would soon become a major cause of breathing problems all over the world. Hospitals began to see an increase in patients with severe respiratory issues, and healthcare workers were on high alert. This virus, called human metapneumovirus or HMPV, quickly became a big focus for scientists and doctors. They worked tirelessly to understand its structure, how it spread and how it could be contained. Finding HMPV reminded everyone that there are many tiny living things we don't know about, and they are always changing. This discovery highlighted the importance of continuous research and vigilance in the field of virology. Even with better medicine and technology, new viruses can still appear and cause big problems for everyone. The emergence of HMPV was a stark reminder that despite our advancements, nature still holds many surprises. HMPV showed us how important it is to keep watching for new viruses and to put money into research to understand them. Investing in scientific research and global health initiatives is crucial to staying ahead of potential pandemics. In the early 2000s, people traveled more and countries became more connected. The ease of international travel brought people closer together, but it also created new pathways for diseases to spread rapidly across borders. This was good in many ways, but it also helped diseases spread. The interconnectedness of our world meant that a virus could move from one continent to another in a matter of hours. HMPV, like other viruses that cause breathing problems, spreads easily through coughs and sneezes. Simple acts like coughing or sneezing could unknowingly transmit the virus to others, making it a significant public health challenge. This made it a tough challenge in our connected world. The global spread of HMPV underscored the need for international cooperation and robust public health strategies to combat emerging infectious diseases. Human metapneumovirus, HMPV for short, is a tricky virus. It's a pathogen that often flies under the radar, not as well known as some of its viral cousins. It's not as famous as the flu or COVID-19, but it can be just as concerning. While the flu and COVID-19 have dominated headlines, HMPV quietly spreads, often unnoticed. HMPV often causes mild cold-like symptoms, especially in healthy grown-ups. You might just think you have a regular cold with a bit of sneezing and a scratchy throat, but don't be fooled. It can be much more serious than a simple cold. In some cases, it can escalate quickly, leading to more severe health issues. HMPV usually starts with a cough that just won't go away, a persistent tickle in the throat that can be quite bothersome, a runny or stuffy nose, which can make breathing through your nose difficult and uncomfortable, and a fever that makes you feel tired and drained, sapping your energy and making it hard to go about your daily activities. You might also have a sore throat, making it painful to swallow or talk. These symptoms are a lot like a regular cold, which makes HMPV hard to diagnose. It's easy to mistake it for something less serious. These symptoms might not sound too bad, but HMPV can be dangerous for some people. It can pose significant health risks, especially for vulnerable groups. Babies, little kids, older people, and anyone with a weak immune system can get very sick from HMPV. For them, what starts as a mild illness can become severe. For these people, HMPV can cause serious problems. It can lead to complications that require medical attention and sometimes hospitalization. The virus likes to attack the lungs, causing swelling and irritation. This inflammation can make it difficult to breathe and lead to respiratory distress. This can lead to bronchiolitis, which makes it hard to breathe, especially for little kids. They may need medical support to help them breathe properly. Sometimes HMPV can even cause pneumonia, a serious lung infection that can be very dangerous. Pneumonia can be life-threatening and requires prompt treatment. Hmpv can infect anyone, but it's especially dangerous for certain groups. Babies and young children are at high risk because their immune systems are still developing. Their small airways can get inflamed easily, leading to bronchiolitis and pneumonia. Older people are also at risk. Their immune systems might not be as strong and they may have other health problems. A mild cold for a younger person can be a serious infection for an older person. People with weak immune systems, like those getting chemotherapy or living with HIV/AIDS, are also at higher risk. Their bodies are already working hard to stay healthy, and Hmpv can be too much for them to handle. Because these groups are more vulnerable, it's important to protect them from Hmpv. A vaccine, when it's ready, will be very important. Until then, washing our hands and wearing masks are the best ways to stay safe. Since it was discovered in 2001, Hmpv has spread almost everywhere. It's been found on every continent except Antarctica, making it a worldwide health problem. It spreads easily through coughs and sneezes, and international travel makes it spread even faster. Hmpv infections happen all year, but they are most common in winter and spring. This is often the same time as flu season, which makes things even busier for hospitals and doctors. Recently, there have been more Hmpv cases in some areas, including China. This is concerning. We don't fully understand why this is happening, but it shows how unpredictable viruses can be. Because Hmpv is spreading globally and can make people very sick, we need to work together to fight it. Countries need to share information, develop vaccines and treatments, and make sure everyone can get them. Section 5. The race for a vaccine. It's been over 20 years since Hmpv was discovered, and we still don't have a vaccine. This is very different from the COVID-19 vaccines, which were developed quickly. So why is an Hmpv vaccine so hard to make? One reason is the virus itself. Hmpv is always changing, making it hard to create a vaccine that works for a long time. It's also good at hiding from the immune system, especially in young children. Another problem is that there hasn't been enough money or attention given to Hmpv research because it often seems like just a cold. It hasn't been a top priority. This has slowed down vaccine development. But there is some good news. Scientists are working on several promising vaccines. These vaccines use different methods, some targeting specific parts of the virus and some using new mRNA technology. The COVID-19 pandemic took a lot of attention and resources away from other diseases, including Hmpv. The pandemic showed us how easily healthcare systems can be overwhelmed and how dangerous a new virus can be. The world's response to COVID-19 was huge and fast, but it came at a price. Money and attention shifted away from other important health issues, including Hmpv vaccine research. The pandemic also disrupted regular healthcare like childhood vaccinations, making some other diseases more common again. As we recover from the worst of COVID-19, we need to learn from it. We need to use what we learned to fight other diseases like Hmpv. Better disease tracking, stronger hospitals and more research are all important for protecting us from future outbreaks. We don't have a vaccine or specific medicine for Hmpv yet, so preventing its spread is very important. Luckily, many of the things we learned during the COVID-19 pandemic also work against Hmpv. Washing our hands often with soap and water is still the best way to protect ourselves. This removes the virus from our hands so we don't spread it to our eyes, nose and mouth. If you can't wash your hands, use hand sanitizer with at least 60% alcohol. Covering your coughs and sneezes is also important. Use a tissue or your elbow to stop the virus from spreading in the air. And stay away from people who are sick. If you or your child are sick, stay home to avoid infecting others. The search for an Hmpv vaccine shows how important research is for global health. Investing in science isn't a choice, it's something we must do to fight infectious diseases. Research helps us understand how viruses like Hmpv work. It helps us learn about their genes, how they spread, and their weaknesses. This information is crucial for developing vaccines and treatments. Scientists make discoveries, and then developers turn those discoveries into real solutions. They use the research to create new vaccines, tests, and treatments. Without development, scientific discoveries wouldn't help people. Research and development need money. We need to keep investing in science to attract good researchers, build good labs, and find new solutions. Fighting HMPV is a long-term effort. It requires dedication, resources, and a unified approach from all sectors of society. Governments, doctors, researchers, and individuals all need to work together. This collaboration is essential to create a comprehensive strategy that addresses every aspect of the virus. By working together, we can lessen the impact of this virus and protect those most at risk. Community support and volunteer efforts play a crucial role in reaching vulnerable populations. Governments need to fund HMPV research, make hospitals stronger, and ensure that healthcare systems are well equipped to handle outbreaks. They must also teach people about the virus, its symptoms, and preventive measures through public health campaigns. Countries need to share information, work together on research, and pool resources to develop effective treatments and vaccines. Ensuring everyone can access vaccines and treatments is vital. Equitable distribution can prevent the virus from spreading further. Doctors are on the front lines. They diagnose and treat HMPV. Often under challenging conditions. They diagnose and treat HMPV, providing critical care to those affected. They also teach people how to prevent it, emphasizing the importance of hygiene and early detection. Additionally, they advocate for more resources to fight it, ensuring that healthcare facilities are adequately prepared. Researchers are constantly trying to learn more about HMPV. Their work is crucial in understanding the virus's behavior and developing new treatments. They develop vaccines and treatments, aiming to provide long-term solutions to combat the virus. We need to keep supporting research to make progress. Continuous funding and support can lead to breakthroughs that make HMPV less of a threat. Sharing findings and collaborating globally accelerates the development of effective strategies. We all have a part to play. By washing our hands, staying home when sick, and following public health guidelines, we can reduce transmission. Getting vaccinated when a vaccine is available is one of the most effective ways to protect ourselves and others. By taking these steps, we can all help stop HMPV from spreading and safeguard our communities.